I have been at this facility close to 40 years. I left the military, came down here, and do general orthopedics as well as joint replacement. And it has taken us a number of years to develop this center, and we now have a center of excellence whereby we replace total joints, we take care of fractures, we treat fragility, osteoporosis, and musculoskeletal diseases at this joint center. We have dedicated nurses that have been, in some cases, with me for an excess of 26 to 28 years. These are the same nurses taking care of our patients, and they not only have the sensitivity and the caring to take care of patients, but they have the experience of taking care of specifically patients that have had replacement of joints. We offer shoulder arthroplasty. The word arthroplasty means the replacement of a joint. Arthro joint, plasty to replace. We replace the shoulder, and we do not only total shoulder replacement and treat fractures of the shoulder, but we also do a new procedure referred to as a reverse shoulder replacement. In certain patients that don't have the soft tissue envelope to maintain a shoulder joint, we do the reverse shoulder replacement. It gives us stability. We do elbow replacements. We do hip replacements. We do knee replacements. And we are trained to do ankle replacements and ankle fusion for the very few patients that need that. We have the ability to do anterior approach, posterior approach, hip replacement. We have the ability to do minimally invasive procedures on all of the joints. And the surgeons on staff at this center are not only board certified, but they keep up with the latest technology. Now, let's put things into perspective. I want you to imagine it's 1990. And in the United States, if you were to ask how many total knee replacements were done around 1990 throughout the entire country, about 130,000. Now, I want you to fast forward, and we're now in the year 2010. That's how many years? That's 20 years later. 600,000 knee replacements in this country. Now, what we're going to do is we're going to go to 2035. I will not be practicing. I hope my son still will be practicing. And I predict that we are going to be doing between 2.8 and 3 million total knees in this country a year. Now, you can create similar statistics for the hip. I say the knee only because those numbers are fresh in my mind, and I read them published in our official journal as recently as 48 hours ago. But in the past 15 to 20 years, for every knee we've been doing in this country, we've been doing a hip. So the statistics are about the same. And I'm going to suggest to you that the quality of life that is offered a patient with a joint replacement is probably one of the most effective, one of the cheapest, cost-effective procedures that we can do for a patient. Because you do a knee replacement or replace both knees in a patient that's disabled and they can get back to work, the amount of money you're saving in 20 to 25 years, which is about how long a good knee will last. Some last even longer than that. And you average into that the amount of medical care the patient would require if he didn't have his knee replacement. And all of the illnesses that are associated with inactivity. People are known to have a knee replaced, lose 50 pounds, their diabetes and their hypertension improves, and all of a sudden there's a new lease in life at the age of 60 or 70. So whatever it costs, if it costs $20,000 or $25,000 for the entire total knee experience, including the surgeon's fee, anesthesia fee, admission to the hospital, it is probably one of the most cost-effective procedures we can do for a patient and offer them quality of life. And this is exciting. Now here's our problem. The problem is that you need individuals like myself to do the operation. And with all due respects to all those young men that think that robotics is the way to go, the idea of taking a knee and having a robot replace it in the next 15 to 20 years is very unlikely. So you need surgeons. We are not educating, nor are we graduating, nor are we training any more physicians in total joint today than we did 15 years ago. Now there's the dilemma. Now, you can look at this as an exciting piece of information. You can look at this as a kind of a ominous sign as to whether or not this care and treatment will be available to everyone. But the bottom line is that if we don't have more than the number of orthopedic surgeons that we have today to do, what did I say? It's going to go from 600,000 to 3 million. That's a five-fold increase, six-fold increase. Where are these young people going to come from? And that's something we have to look at and plan ahead. The Orthopedic Academy is working very hard. We have a Society of Hip and Knee Surgeons that are addressing this problem on a daily basis. But it is so exciting. I had a man walk into the office yesterday. He had both of his hips replaced 4 months apart at this facility. He has lost 45 pounds. He's got a smile on his face. The pain is gone. He's no longer taking anti-inflammatory. He's no longer taking narcotics. He is out in the community enjoying life. This is a wonderful, wonderful situation. This man puts his arms around me yesterday. He gives me a hug and he says, Dr. Porth, wow, in 4 months my whole life has changed. And that's what we do. And it's very exciting. And it still continues to be a high today, and I've been doing it for almost 40 years.